Okay, the abdomen with medical patients. We talked a little bit about the abdomen and trauma, right? You guys should now at least have a mental image of where everything lies in the abdomen. But now we're going to talk a little bit more about the organs specifically and problems that they can have outside of trauma. So a general name for So acute abdomen is the general name for presence of signs, symptoms of inflammation of the peritoneum, which is the abdominal lining. So think of all your bowel, your intestines, all your organs that kind of sit in a sac, which is the peritoneum. All right. So you can kind of basically visualize this. This is the mental image I expect you to have. You should be able to see everything, and when you guys do your assessments, I've shown you how to do it cross-sectional, where you do the upper quadrant and then the lower quadrant from one side to the other. This is what you need to be thinking of is in each quadrant. So this is what I'm pushing on. You need to know what is where. Okay, you need to know that the spleen's over here, that mostly the liver's over here, although look, the liver kind of goes all the way across, right? Okay, so you need to have this basic view of what's going on in the abdomen. Solid versus hollow organs. Our solid organs are going to be the spleen, the liver, the pancreas, and the kidneys. Those are the ones that bleed an awful lot. And then hollow organs, your stomach, your gallbladder, your duodenum, large intestine, small intestine, and your bladder. Okay, abdominal cavity, here's a cadaver. You can see the intestine going around. Yeehaw. Okay, acute abdomen for us in EMS in the field. You just saw the picture of the abdomen, right? There's a whole bunch of stuff in a tightly packed space, right? So determining the exact cause is not necessary for us. The important factor is recognizing an acute abdomen is present. Why is an acute abdomen significant? Well, if there's inflammation in the peritoneum, then that means that there's an infection process occurring. And if that infection gets into the bloodstream, it can cause sepsis and they can die. Right? So we want to be aware of this very early on and get people treated. So history, where do you hurt? Try to get them to kind of pinpoint. Also, you're going to assess, you're going to push all over the abdomen and try to figure out where they're hurting. The longer it's been going on and the more the inflammation has spread, the harder it's going to be to determine where or what it is that's hurting them. Okay? So realize that abdominal pain locations do not always correlate well with the source. You can also get referred pain. Have them describe the pain. Steady pain is likely an inflammatory process. Cramping pain is likely an obstructive process. Okay, so that could be as simple as cramping pain could be a bowel obstruction or constipation, right? It could also be a blocked kidney duct, or the gallbladder duct could be blocked. Things like that. Was onset of pain gradual or sudden? Because that also makes a difference. Sudden, we're thinking more of a trauma type thing where it's been perforated, there's a hemorrhage, or an infarct has occurred. A gradual onset, we're thinking peritoneal irritation or hollow organ distension, meaning there's something more chronic occurring going on. Okay. Does pain radiate or travel anywhere? So again, this is talking about more of the referred pain. If, for example, if the right shoulder is cramping or hurts, angled to the right scapula, then that could mean that they have gallbladder pain because of that nerve pathway following up to the right shoulder. Does it rotate around the flank? So kidney stones, a lot of time it's flank pain. It hurts in the back versus in the front. Duration, okay, 6-hour duration, is there any, so less than 6-hour duration equals questionable surgical significance. nausea, vomiting, bloody, coffee grounds. Any blood in the GI tract is an emergency until proven otherwise. You don't know how much they're bleeding. So when we look for bleeding, it's not necessarily bright red blood that we're going to see. It could be dark brown digested blood, what we call coffee grounds. If it's in their poop, it'll be kind of black and tarry. And you can ask them, have you had any dark tarry stools? Have you vomited? Was there any brown coffee ground looking stuff in your vomit? You can check it out yourself if there's a sample available. But you can't tell by how much they're excreting, how much they're actually bleeding internally. Okay? So any sign of blood is an emergency until proven otherwise. Usually these people will bleed slowly for a while. The ones with GI bleeds could be caused by a peptic ulcer, that type of thing. So they bleed slowly for a while, and then it finally eats through a vessel that's big enough that they start losing blood more rapidly. But because of the chronic bleeding, a lot of time these people are already slightly anemic, or they've already had some blood loss. So when they do start bleeding more rapidly, they're already behind the grate. They're already behind the 8 ball. Has there been any change in their urinary habits or their urine appearance? Is it real dark? Is it cloudy? Is it foul smelling? It could be that they have a UTI or a bladder infection. Again, change in bowel habits. Are they having frequent diarrhea? That can cause inflammation, such as diverticulitis, which is inflammation of the bowel. Appearance of bowel movements. Again, melena is a specific term for the dark tarry stools. So that would be blood in their poop. And the reason why it's dark and tarry is because it's been digested. It's passed through all of the intestines, and it's just the garbage. It's stuff that's being kicked out. Regardless of underlying cause, vomiting or diarrhea can be a problem because of associated volume loss, right? You can poop and vomit yourself into hypovolemic shock. Females, make sure you ask them when their last menstrual period was. Have they had any abnormal bleeding or other discharge? In females of childbearing age, especially, abdominal pain equals an OBGYN problem until proven otherwise. And that could be ectopic pregnancies, could be pregnancy, could be a lot of different things. Okay? Vital signs, tachycardia could be an early indication of shock. More important finding than the blood pressure. Blood pressure is a late finding of shock. Rapid, shallow breathing could be an indication of peritonitis because it hurts to expand the chest all the way. The diaphragm puts pressure on the abdomen, so they may be taking real rapid, shallow breaths. Tilt test should be done with non-traumatic abdominal pain patients. Okay, what's a tilt test? A tilt test is where we take 3 blood pressures. We take the first one with them laying down and a corresponding heart rate, and then we have them sit up, ask them if they're dizzy, take another blood pressure and a corresponding heart rate, and then we have them stand up, see if they get more dizzy, check a blood pressure, corresponding heart rate. If the blood pressure drops or the heart rate increases 20 beats or more from their resting position, then they are hypovolemic. Okay? Even though there may be no signs of external blood loss, someone who's had, nausea, vomiting, or just the abdominal pain or diarrhea, by doing a tilt test on them, you can determine whether they're hypovolemic or not. Okay? General appearance, someone with peritonitis, they're going to want to lie very still because it shows that there's the inflammation. It's very painful to move. If they're really restless, they can't hold still, they can't find a position of comfort, then it's more likely an obstruction, like a kidney stone or something of that nature. So think infection if they lie still and don't want to move. Think obstruction if they're uncomfortable and can't hold still. General impression of the patient, are they shocky or not shocky? Inspection, is there any abdominal distension? Is there any bruising around the umbilicus or the flanks? Also, when you're palpating the abdomen, again, just like trauma, you're checking for pulsating masses or warm spots, because it could be a AAA, right? It could be a dissecting aorta causing a lot of abdominal pain as well. Bowel sounds. Bowel sounds are good to listen to, really hard to hear in an ambulance, so you're going to want to do it in the house. You're going to want to do it when they're laying still and when there's not a lot of external noise. Listen for 1 minute in each quadrant. Listen before you palpate the abdomen. Okay? Absent bowel sounds equal peritonitis, ileus, or shock. Should be performed before palpation. If they have absent bowel sounds over one portion, but they have good bowel sounds on another, could indicate that they are constipated or have a bowel impaction in a certain area. Auscultating bowel sounds has no pre-hospital value in trauma patients. So in trauma, we're not real worried about it. But in the medical patients, it can tell you a lot. When you listen for it, and maybe you guys can listen to each other today, it sounds like just I mean, I don't know, you guys have all heard a stomach growl. It kind of sounds like that, but it's much quieter. But it can also just be like little poppings, clicks, crackling. But you should hear, if you listen for 10 seconds, you should hear 5, 6, 8 different kind of like sounds. Someone who has diarrhea, that type of thing, or a real upset stomach, you're going to hear, constant sounds in that 10 seconds. Okay? Or you may hear absent sounds, no sounds at all. May mean that there's an obstruction or a problem. Okay, palpate each quadrant, work toward area of pain. So if they say they hurt in the right lower quadrant, which is where your appendix is, which is a very common cause of peritonitis, is your appendix gets inflamed and infected and causes peritonitis. So if they say the right lower quadrant hurts, then start palpating the left upper quadrant first, and then work your way around. So do left upper, right upper, then left lower, and then right lower. So go away from the pain and say, oh, no, I don't hurt there, I hurt lower. Say, that's okay. Do you hurt over here? And they say, not really, I hurt lower. Say, do you hurt over here? No, not really, I hurt over here. Oh, yeah, that really hurts. Okay? So start away from the pain and gradually work closer to where you get the most pain response. Left lower quadrant is your colon. Okay, so going back, there's, there you go. That's where everything is. You need to memorize that and give you kind of a visual. You need to know what's in what quadrant. Okay, and then here's a more basic. These are solid. They bleed a lot. These are hollow, they get inflamed and obstructed. Okay, airway, just like anybody else, oxygen to 94%. Anticipate vomiting, especially if they've got a history of vomiting. Don't give them anything by mouth because they will probably vomit it up. Anticipate hypovolemia. So you may start treating for shock early. In adults greater than 30, consider possibility of referred cardiac pain. Okay, a lot of people who are experiencing heart attacks won't feel chest pain. They'll feel nausea, indigestion. Okay, kind of abdominal type symptoms. Just know that that can be referred cardiac pain. So, and then in all females, consider possible OBGYN problems, especially what we call tubal ectopic pregnancies, which is a life threat if it ruptures. Okay. Appendicitis, usually due to obstruction with fecalith, which is like a stone. Appendix becomes swollen and inflamed. Gangrene, which means it's rotting. Possible perforation, it can rupture. If it ruptures, they can have significant blood loss. Very quick, easy surgery. When I had mine, I showed up at the hospital at 8 a.m.-ish. Well, actually, I went to the ER at midnight. They got me to the surgical center at 8 a.m. They did the surgery. I was discharged 5 o'clock that night. Okay, not usually a big deal. They pump you full of antibiotics, and as long as your vital signs are stable and you haven't crossed into being septic shock or anything like that, it's pretty much a same-day surgery now. Anyway, pain begins periumbilical, usually, so that means in the middle or under the umbilicus, and moves toward the right lower quadrant the longer it goes on. Nausea, vomiting, anorexia occurs. Patients on side, so in what we call the fetal position, they're going to lay on their side and pull their knees up in a flex position. Pain may not localize to right lower quadrant if appendix is in odd location. So my appendix actually wrapped around and was directly south of my umbilicus. So almost where you'd think my bladder is where my appendix was. So everybody's can move around just a little bit. It all just depends on the length of their intestines and where it's ended up. Sudden relief of pain can equal a perforation because it's the swelling initially that's causing the pain. And if the appendix ruptures, they may feel a lot better short term until that causes widespread peritonitis and sepsis and all that. Okay, duodenal ulcer. An ulcer is, think of it as literally a hole in the intestine or in the stomach, depending on where the ulcer is located. It's steady, well-localized epigastric pain, burning, gnawing, aching, increased by things that they eat, such as coffee, stress, spicy food, and smoking. Decreased by alkaline foods, antacids. Alkaline foods would be like milk. A lot of these people will drink milk because it makes the ulcer feel better. May cause massive GI bleed. Perforation equals intense, steady pain. Patient will lie still and have that rigid abdomen. If it perforates, it's bad for a couple of reasons. One, you may have some blood loss and bleeding, but two, remember how I told you that the stomach and your intestines is actually outside your body, right? Like everything you eat, you chew it up, you swallow it, it's outside your body, and then you poop it out. It never enters your body. Well, when you perforate a bowel or a stomach because of an ulcer, you're letting all that stuff that's supposed to be outside your body is now inside your body, okay, where it doesn't belong. The hydrochloric acid in your stomach eats and destroys and liquefies tissue, not to mention any of the fecal type substance. It's like pooping in your own stomach, okay? That's why it causes severe inflammation, which can lead to sepsis, because now you got all this crap in your stomach, in your body, that doesn't belong there. It belongs in that hollow tube where it can be excreted out as poop. Okay? So kidney stones, mineral deposits form in the kidney and move to the ureter. The ureter is pretty darn small, often associated with history of a recent UTI. Severe flank pain radiating to the groin or scrotum, especially as it moves. Nausea, vomiting, bloody urine, hematuria. Extreme restlessness. For guys, it feels like they're in labor or whatever, you know. But it's very painful, very uncomfortable, especially depending on the size of it, how smooth it is, or how jagged it is. Most of us pass little stones all the time and never know it and don't have any problem. For other people, either their ureter is smaller or it's kinked and makes a few more turns or something and the stones can get stuck, or if you drink a lot of sodas, things like that, it can increase the production of minerals in the kidneys and cause more stones and yada, yada, yada. A lot of time they get a lot of the mineral deposits in the kidney themselves, and if you have kind of chronic recurring kidney stones, they'll look at your kidney and see what the buildup's like, and they'll break those stones free and cause you to have a whole bunch of them in succession to kind of clean it out and help it out, which obviously is no fun. Okay, a AAA or an abdominal aortic aneurysm. Here's the abdominal aorta coming down. Someone with chronic hypertension has pressure on those arterial walls all the time, too much, well, eventually the arterial wall will start to balloon out and engorge, and it may even tear, allowing some of the blood to escape in between like the vessel lining and the smooth muscle that lines the aorta, and you'll get like a pocket of blood. And eventually that can rupture too, and you'll have free flowing blood. So localized weakness of blood vessel wall with dilation, like a bubble on a tire. Pulsating mass in the abdomen can cause lower back pain because the aorta actually follows the spine. It's anterior to the spine, but it's retro to most of your abdominal organs. It's kind of in that gap back there. Can cause lower back pain. Rupture equals shock or exsanguination. If it ruptures, you can bleed to death within a matter of minutes. Okay? It does cause weakness because of the big bubble and whatnot. You can get restricted blood flow going down to the legs. So acute sudden tearing abdominal pain with weak legs especially is AAA. There are a lot of people who have AAA bubbles, if you will, that have been detected that elect to not have surgery, or the doctor says it's not bad enough yet, and they try to find a balance where they'll watch it for maybe a year, maybe 2 years, until they think it grows too big, and they measure it in millimeters or whatever, and they look to see if it starts growing. Some of them, they'll get one that's, let's say this is supposed to be 4 millimeters. They have an aneurysm that's at 6 millimeters, and it may stay at 6 millimeters for 10 years. Okay? But then they go in one day and they say, oh, wait, it's at 13 millimeters. Now we have to go in. They'll surgically cut the aorta here. They'll cut it down here, and they'll put in a fake aorta, made out of mesh or whatever, and try to get that to adapt to the body and work. It will allow blood flow, but it's still not the great artery. Doesn't work perfectly as well, and it's something like like 80% of them die on the OR table type of thing. Like it's a big deal. So, pancreatitis. What does the pancreas do in your body? The pancreas, it excretes stuff. Okay, it excretes hormones. The one that we really worry about the most is insulin. This is for people who have diabetic problems. So the big thing that it releases is the insulin. Inflammation of the pancreas triggered by ingestion of alcohol or large amounts of fatty foods. So people who are chronic drinkers can kill their pancreas. Nausea, vomiting, abdominal tenderness, pain radiating from upper abdomen straight through to the back. Again, the pancreas sits up kind of high under your xiphoid, so it can be really difficult and confusing to call it pancreatitis, or is it referred chest pain. It's kind of in that no man's land of, it kind of depends on your patient. Someone who has a large drinking history, you might think that it's liver cirrhosis or pancreatitis. It's okay to mistakenly treat this as cardiac if the patient has those other additional risk factors. Okay, I'd rather have you make that mistake and say, hey, not real sure what this is, but it could be cardiac, so we're going to go with the aspirin nitro, see if that helps, and take you to the hospital to get evaluated. That's kind of the right approach, because you're not always going to be able to know exactly what it is. They may have sign symptoms of hypovolemic shock if this is perforated type of thing. Plus, someone who's a chronic alcoholic probably doesn't eat well anyway. Cholecystitis. These are gallstones or inflammation of the gallbladder. Commonly associated with gallstones. More common in 30 to 50-year-old females. Nausea, vomiting, right upper quadrant pain, tenderness, fever. Attack is triggered by ingestion of fatty foods. So over time, your gallbladder gets full of gallstones, and you have a gall bile duct or a reservoir for bile, which bile is used in digestion and whatnot. Well, it forms, as all these fatty deposits get in there and whatnot, it calcifies, it forms these stones. And then you kind of have some pain or some indigestion, and then one day, when it's full, anything you eat that's fatty triggers severe pain because your body can't handle it anymore. It can't digest it. It can cause projectile vomiting. Your body will reject it. You'll try to take a bite of Chinese food and your body will basically spit it right back out, and it'll cause that severe pain. They'll surgically go in, take the gallbladder out. Usually not a big deal, again, unless it's caused sepsis, that type of thing. Bowel obstruction, doesn't that look lovely? Blockage of inside of the intestine, interrupts normal flow of contents. Your bowels work on something called peristalsis, which is continual squeezing, which is regulated with smooth muscle, autonomic nervous system, kind of moves stuff along through the intestines, kind of milks it along constantly. Causes include adhesions, hernias, fecal impactions, and tumors. Okay, crampy abdominal pain, nausea, vomiting, often of fecal matter, and abdominal distension is all possibilities. So if you do have an obstruction of like a fecal obstruction, that's going to back up, and you're going to start puking, and you're going to puke digested crap. Okay, that's a good sign that you have a bowel obstruction. Bowel obstructions occur usually in real tiny little kids who don't drink enough fluids or whatever, or the elderly people get them a lot. Okay, again, because they have limited oral intake and whatnot. Esophageal varices. Okay, you have your esophagus coming down here. You have a lot of veins and arteries that kind of feed off of that. Specifically, people who drink alcohol and people with liver disease, these veins return from the liver to the esophagus. They're kind of connected. Okay, so what happens is someone who has a lot of alcohol, whatnot, is it causes these veins to engorge and swell because of the blood flow causing problems. Well, what happens is they can also rupture. And when they rupture, they're in the esophagus, they're not in the stomach, so the blood comes up. Okay? So these guys will literally start puking out bright red blood, projectile vomiting. It's very, very, very life-threatening. It's difficult to control. It's not really something that you can go in and hold pressure on to stop the bleeding. So, again, it causes massive upper GI bleeds. So upper GI would be stomach and above. Lower GI would be below there. So lower GI bleeds usually produce the dark tarry stools. Upper GI produces bloody vomit and coffee grounds. Okay? Questions about the abdomen? Yay, nay? Okay, questions about anything we've gone over so far this morning? It's kind of a lot, huh? A whole bunch of illnesses.